Member for Chilliwack, Kent.
Thank you, Mr. Speaker. I've given examples of social costs of ignoring gender health, but there's also individual costs. Beyond the pink tax that many of us have heard of on everyday goods and services, there are very real individual health-related costs to being female. There's period poverty, birth control, time off related to reproductive health issues. There's a cost to lives and quality of lives and the reality that often women's pain is dismissed as anxiety or not believed or recognized as a physical ailment. This costs us. Ineffective testing that is not designed for our bodies or is not effective for us costs us. Late detection, not knowing the signs and symptoms in women, lack of research, lack of diagnostics cost us. Lack of choice, depression, anxiety, fear of losing our jobs, self-medication, ignoring symptoms as we care for others instead, all of this costs us. There's so much work to do, and I'm so grateful to all the healthcare professionals, advocates, and researchers of every gender who continue to call out for change, who continue to publish and ask for awareness and policy that supports health, which recognizes the range of gendered needs and differences. This is especially true when it comes to supports, treatments, procedures, coverage, access, research, and education. And I thank those who recognize that women's health is impacted by many different areas. I'm also proud to be part of a team that is committed to listening and doing the work and has already started it. There's so much yet to do to fix a system that has been built over a long, long history. But we've begun by committing to make health more affordable for women, by addressing period poverty, giving easier access to medical abortion, and addressing the cost of contraception, by providing publicly funded, gender-affirming lower surgeries in BC, by recognizing gender-related risks in BC's mental health roadmap and investing in specific mental health supports for women. We have a Parliamentary Secretary for Gender Equity who recognizes that gender-based violence is not just a justice issue, but a health issue, and we must work on best practices for accessing health care following an assault. We know that gender-based violence impacts women's health and comes at an individual and social cost that was exacerbated by the social and economic impacts and restrictions of COVID-19. And we have put supports and resources in place to help those for whom home is not safe. Together, we can move past the confines of old definitions, habits, and assumptions, and advance equality and build a brighter future for women, girls, and gender-diverse people in British Columbia. We need everyone of all genders to become leaders in healthcare across BC. One last note, if you have delayed your tests during COVID, your routine mammogram or your PAP, maybe because you were busy or nervous or because you were taking care of others, it's time to rebook. You are your strongest advocate, and you cannot care for others if you do not care for yourself. Make the appointment. Thank you.